Do you recommend having a mole removed by a plasma set pen? Full disclosure, I don't know if it's good or bad of me to say this, but hey, among friends here. So I've had to Google plasma pen. I mean, I've heard the words, but I didn't know what it was. I've got to be honest, I still don't know what it is, but it's some kind of, oh, I've lost the page now, but it's some kind of non-surgical energy delivering device. So no, I don't recommend having a mole removed by plasma pen. I'm not even sure if you could. Is it something that it was talking about other stuff? Is it something that they say that can remove moles? I'm not even sure if it could remove a mole, but I wouldn't recommend having a mole removed by a plasma pen. So mole removal involves removing a piece of skin, and there are ways you can kind of deliver energy to the skin to I guess remove that piece of skin. I'm not sure if plasma how it delivers the energy, whether it's sort of focused and like a cutting thing, or if it's just sort of like a laser thing or what. But either way, you're going to have to remove the thickness of the skin. So whether it's a burning like a laser, or some lasers do sort of cut it out. Um, they both. So the reason I think usually people are asking this is because they think it's less scarring. People often think, oh, I want to have this way of mole removal. What about a plasma pen? Because that's not like surgery. That's kind of like a topical thing. Or what about using this acid or this vinegar or this whatever laser, or because that's not going to give me a scar. And if you're going to deliver enough energy to remove the mole, you're going to destroy that thickness of the skin, and you're going to leave a mark of some kind. And there's different ways to destroy that skin, and a scalpel is one way, a laser is one way, acid is one way, a spoon to scrape it off is one way. So they all destroy that piece of skin. Personally, I don't recommend laser. I don't recommend plasma pen, because they sort of burn it, and they, well, I say they, I don't know what plasma pen does, but laser sort of, it might be like laser, burns it, and you can't send it for histology. Now you might say, well, I know it's benign, it doesn't need to be sent for histology, in which case fine, you could do it, but you can't. It's a bit more difficult to control the level of damage to the skin with these things. So I'm saying hi to Ayat, but it's not letting me say hi. Is that saying hi? Say hi. So it's a bit more difficult to control the energy of a thing like laser. I mean, as I say, I don't do it, so you probably have to speak to someone who does it to get a balanced opinion. And so the concern is if you deliver too much energy, you will create extra scarring, and if you don't deliver enough energy, then you will not remove the mole. So you kind of have a mark, and then the mark heals, and the mole's still there. So it's, again, probably best speaking to someone who does these sorts of treatments to see what they say about it. But it is not something I recommend, because it's more difficult to predict the level of scarring, I find personally. And as I say, I only do excision, so you can do a shave or a formal excision or whatever, but I use a knife to actually remove that piece of skin with the mole in it. And I find that is more predictable in terms of the level of scarring that you're going to give. And you can be a bit more kind of realistic to the patient about what they can achieve. Well, I shouldn't say more realistic, because maybe all these people are realistic as well. So anyway, give patients an idea of what they can achieve. And B, what was B? Oh yeah, histology. Send it for histology. So I think it is. A lot of people say that you don't leave scars, and I want to have laser because laser doesn't leave scars. Ow. But or I want to have plasma pen, or I want to have acid, or whatever. But your mole might be quite superficial, so it hasn't damaged that much of the skin, so the scarring isn't that bad. Or it might be like when we do excision, so you plan it, and it heals so well that it's hard to see the scars. Usually there's some kind of mark of where that was removed, but it often heals so well that you can't see it. So yeah, that's So yeah, I do not recommend the plasma